I think it's very important to have clinical practice guidelines. They represent a compilation of all the evidence in one place that's been reviewed systematically by the experts in the field. This forms a great foundation for practitioners and clinicians in terms of putting the starting point out there. Immune thrombocytopenia, or ITP, is a condition that results both in platelet destruction as well as impaired platelet production. This results in a decreased platelet count, which places patients at an increased risk for bleeding.
When ASH decided to revise the guidelines, ASH had really put a different methodology in place than was in place in 2011. And now ASH has a whole staff of people that are really focused on guidelines.
ASH is committed to really trying to keep guidelines as up to date as possible, recognizing that there's lots of times where new evidence could very easily shift a recommendation.
This guideline will be very extensive. In addition to the online report, there's also all the evidence. So although the recommendation itself is just a few lines, the thought process and the data behind that is actually quite extensive.
I think it's important for practitioners to look not just at the recommendation, but then also the quality of the evidence that went into that recommendation. And what that's telling you is, how confident are we that additional evidence would or would not change this recommendation?
We hope that people will look at the guidelines and look at all the evidence. There are some practitioners that really just want the bottom line, but there's many people that want to know more. So if you don't think that recommendation fits for your patient, it's extra information for you to be able to go back and look at that evidence and actually see what it is, see what the pros and cons are, see if your type of patient really was represented in those trials so you can make the best educated decision on how to treat your patient.
I think also by guidelines drawing attention to things such as resources and patient values, hopefully it might change or structure just even the way a physician communicates with their patient, or the things that they think about that maybe they didn't think about before. What's a patient's goals? What are their goals for the treatment? And is there something in the literature that may, when I go back and look at all the details, is there something about one drug that might make it more preferable for my patient? And I hope that by considering the whole framework, it can narrow that gap and really help practitioners identify the right therapy for their patient, using the guidelines as a foundation to do that. The ASH Committee on Quality is really invested in guidelines, and I think it's important for the membership of ASH to recognize that they're considered part of this process as well. It's not just a panel, it really is the entire organization that's invested in these guidelines. So just to encourage the membership of ASH to be actively participating in anything that they receive from ASH in the form of communications regarding these guidelines, because their feedback is priceless to us.